Actually, it's midday right now because this is a recorded session, but I'm Chad Duplantis, and with me today is Jeff Horowitz, Dr. Jeff Horowitz,
Hello, everyone.
out of Conway, South Carolina, and I'm out of Fort Worth, Texas. So with us today, we have a couple of special guests. We have two very special people in each of our practices. From my practice here in Fort Worth, I have Holly. Holly, would you like to wave at everybody? Holly has been with our practice for how long, Holly? 10, 12?
13.
13 years?
Yeah.
And you know, I can never get
Nice
that right.
going, Chad. That'll cost you.
No, I probably will never get that right because
No.
prior to Holly being a hygienist in our practice, Holly was a patient in our practice since she was a teenager. So I've known Holly forever. And when she mentioned that she was graduating from hygiene school, I said, perfect timing. You know, can you come work for us? And it's been great ever since. So Holly is a practicing everyday hygienist. We're going to let her introduce herself in just a minute. But Jeff, who's your special guest with you?
My special guest is a hygienist that I've been working with now for 18 years. So as I told you earlier, we actually know each other's bad habits by this point.
Right.
So I have with me Jennifer Brown. She's an amazing hygienist, and she's 100% in on wellness dentistry and the orosystemic connections. So I'm really excited to let her share being a nerd with me.
Awesome.
Hey, everybody.
Awesome. Well, let's start with letting them introduce themselves. So, you know, I think we said that we're going to ask each other's hygienist questions. So, Jennifer, would you introduce yourself to our viewers?
Hygiene swaps sounds so wrong, Chad.
Yeah. Hey, that's an episode for another day. You know, you come work in my practice for a day.
Wait, wrong Facebook group. I'll get it right.
Well, I'm Jennifer Brown. I'm a hygienist for Dr. Horowitz, like you said, for the past 18 years. I'm originally from Pittsburgh, Pennsylvania.
Woo-hoo!
And I moved here in 1991 in South Carolina. And I ran my father's motel and mini mart that he had on Ocean Boulevard on the beach for quite a while. And I decided to get into dental hygiene school. And here I am. And
Awesome.
I really love what I do. I love my patients. And looking forward to a few more years.
Awesome. Awesome.
Ollie, let's hear from you.
All right. Well, he kind of told my opening speech to any new patient.
Yeah.
My name is Holly Arndt. Been a hygienist for 13 years, so my whole career with Dr. Duplantis. I love my job. It's something else cool about myself is I started out in oral surgery, just kind of helping file when I was 16 and actually had never been to the dentist.
Wow.
So he kind of got me on the straight and narrow, and I came to the office that I'm at now. So literally my whole dental life has been in our office, and it's kind of inspired me to help and encourage other people when they get enough nerve to come in. Yeah. So.
And when Holly first started working at our office, she drove a huge pickup.
A one-ton dually.
Yeah, she had a dually that she drove to the office. I mean,
Very cool.
Yeah. She was the rodeo queen back in the day. So anyhow, let's get to the meat of the presentation. So the whole reason that we wanted to bring you all here is that, you know, when all of this COVID started, there was and I think there still is to certain extents, there's a division between dentists and hygienists. And Jeff and I have personally not experienced that. I think it's been great in our practices, and I don't know why that is. So maybe you all could explain that, but I'm just going to tell you a little story about Texas. So in Texas, the governor came out with the state board mandates, you know, about us going back to work, and everything was great. And then all of a sudden the Dental Hygienists Association got in and they changed quite a few things amongst the mandates going back to work with the governor. And it really didn't make it that bad, but it was quite different from the initial proposal. So it in our practice, and Holly, you're more than welcome. You are off the clock. You are more than welcome to tell me if it caused a riff or not, but I don't think that it did in our practice, because I think Dr. Kirkham and I are both receptive to it. But I'll let you tell when Dr. Horwitz does. But Jennifer, I'm going to ask you, has there been a riff or anything in your practice between your hygiene department and your dentist department? You know,
I'd say definitely not. I think it made us closer. We're all on the same page. We know Dr. Horwitz took all the time to get all the safety precautions in place before he came back. Our only concern was if we came back, we were worried we wouldn't have any patients, and that's far from what happened. We were busier than ever on hygiene. So I don't think there's any kind of a rift at all, actually.
great.
You know, it's a little different too, Chad. You know, I just have not seen it as much in South Carolina as I've heard in some other states. You know, it really seems that as far as our state, there seems to be more of a collaboration, you know, between the dental hygiene groups and the dental groups. And I'm not sure where that really came from in a lot of the states. I know maybe some of it had to do with independent practice, but we just hadn't really seen that. I think, you know, most of us work really well together. And that actually it brings up another question, which Jennifer mentioned about safety. I think one of the most important things is that everyone, both patients and employees, need to feel really safe in this environment. So, Holly, I put it to you when you heard you were going back to work. How did you feel about this situation?
I was excited to come back, but you know, at first I was a little like I wasn't quite sure what we would be doing, but I knew that Dr. Duplantis and our other dentists were going to have everything in place for us to feel safe, down to a new washer and dryer and shedding our clothes. So I tell people, like, no ounce of me is walking out of the door, because I'm head to toe feeling safe. And then the extra stuff that they had for us to sanitize our room so we can feel like our patients are also being taken care of.
And are you in charge of the ortho mister?
I do have fun with that thing. But just to kind of add to it, I would temp some on Fridays that I was off, and I was like, absolutely not. I'm not going out there, because I know that there are offices that aren't doing it, but I knew my office, I was safe. So.
You know, that's a really good point, because I have heard from other hygienists, and Holly, I'm going to ask you, and this is a trick question, but what is the one question that you've heard me ask from the day we decided to go back, and I ask probably a couple times a week, and what is that question?
Do you feel safe?
100%.
Yeah.
And that's what I want. And I've asked every single staff member that, do you feel safe? And if they say no, which they haven't, thank God, which they haven't said that, then I want to know what we could do to make them feel safer in this environment. Jennifer, with what Jeff said, you know, asked Holly about feeling safe. Do you feel safe?
Oh, definitely. I actually have this asthma cough, and it was always really bad before the COVID came out. And after you put the new air filter in, or I'm not sure what it's called, like an ozone cleaner.
Yeah.
I hardly ever cough anymore in that office. So I know that air is clean. So I know that's sucking up some germs. But I actually kind of like the way we're doing things better now than we did before, because all the patients stay out in the car, in the parking lot.
Right.
And we bring them in one at a time. That way I know if I'm running behind, I know they're in the car, comfortable and waiting. And they know that we know that they're out there. So it's nice.
Like that too, Jennifer.
I know, I do.
Yeah. Now maybe I could put an office in the waiting room.
You know, Jeff, I thought the same thing. Maybe we could just turn it into another operatory, you know?
Yeah, we got some extra space.
Why not? So I'm going to flip that question a little bit, and I'm going to go back to Jennifer and let you answer again. what kind of feedback have you heard from your patients? Do they feel safe?
And they definitely do, because they're scheduling and they're coming in, and there's people that won't even go to the grocery store, but they're coming to the dentist office. So I don't know if it's because they feel that, confident in what we're doing. But I might have had a few people put off their appointments till later on in the fall, but not many. And I'm talking about elderly people also. They're all scheduled and coming in. So that sounds pretty good. I'm just surprised. I'm very surprised over it.
It has, Chad. It's been, it really, I think it's a combination of things. I think, we actually use social media to some degree to put out all the measures that we were taking to keep everybody safe. I think that was a big help. When the patients come in and see it, I think it's really, they tell everyone else, you may get it in the 7-Eleven, or you may get it, at Walmart, but you ain't getting it there. And that's, really what we're charged with. So, but, we've had to do some things differently now. And I agree with you, Jennifer. I think some of the things we're doing now are things that could end up lasting. So, Holly, I've actually got a question for you, and that is, what are some of the things that you're doing differently now than you did before? Some of the things that you might even say would stick around after this thing is over.
Yeah, for sure. So kind of like you guys, we have a virtual waiting room. So when people arrive, we let them know, hey, hang tight, we'll be out as soon as we can. Getting them in temp check, filling out their consent form. We pre-screen day or two before they come in. So, and with that, I really feel like our patients care about us because they've all been there for so long. So I feel like they're really going above and beyond to make sure they feel healthy, which makes me feel better too. They're not lying about their screening. And then we're taking them straight back into our rooms where, they do the pre-rinse. So then they're cleaning. I tell them, like, once you're in my room, it's pretty much like a normal cleaning besides all the beautiful attire that I put on.
Right.
But I took, oh, sorry.
No, I was going to ask you, are you typically using like ultrasonics, or are you avoiding that to some degree, or,
Yeah, so in Texas, we're only allowed to use it on periodontally involved or diagnosed patients. But even with that, I'm really trying not to, unless I just feel that it's not for their best health. But yeah, honestly, I've probably only used it about 3 or 4 times.
So that's really interesting, and that's not something that we planned on really talking about tonight, Chad. But tell me a little bit about that role. Does that strike you as odd, Jennifer?
That's what I've been doing, the same thing.
But no.
I'm sorry.
But the fact, or the state only said that you couldn't use ultrasonics during the pandemic.
No, it's indefinite.
No, now.
It's indefinite right now.
We can't use it for any regular prophy appointment.
Right.
That's interesting that the state went that far.
Well, what irritates me the most is a couple weeks ago on Dinks, we had Brent Downs on. And the day that the pandemic hit, Brent calls me and says, hey, can I come over to your office? I said, yeah. He goes, I got to test some equipment out. And so that's where he revived. And I'm just going to go ahead and say that it happened in our office. Holly, is that correct or not? They revived safety suction and 3D printed it, and we tested it out in our office.
Several times.
I turned Brent onto the head lobbyist for the Texas Dental Association, who's a friend of a family member and the best man at my wedding, who's a lobbyist in the state of Texas, pointed me in the direction of this guy, Jess Calvert. And I said, Brent, you've got to get in with Jess Calvert and tell them, because one of the things the state board never took into consideration is that we're all about minimizing aerosol production. Okay, well, that doesn't mean get rid of the Cavitron. I think you should say you can use the Cavitron if you have aerosol reduction measures in place.
Absolutely. That's the point. I just don't like it when agencies kind of overstep the boundaries of what it is that they really understand. And,
right.
You know, sometimes it gets in the way of good patient care. And so, you know, just like, you know, hygienists not being able to use a laser in South Carolina. I mean, it's, you know, you never know where some of these rules and regulations come from, but you know, I'd really like to see it become more universal across the United States. I don't know if that's going to happen or not, though. So
I don't either.
I hated to get off topic there,
No,
but
it's good.
that was so interesting for me. I'd not heard of any other state agency doing that.
It is interesting, and you know, I'm going to turn it over to Jennifer again, and I'm going to ask you two questions. The first part is, and Jeff and I have been in contact through all of this, so I know that anything that Holly mentioned,
Socially distanced contact.
anything that Holly mentioned, in addition to that, is there anything else that you would like to cover that your office is doing? And the second part of that question is how are you all handling all of this backlog or this jam of patients that we really didn't get to see for 45, 60, whatever days, however many days it was, wherever you are? How are you handling that and bringing those patients back in through the hygiene department?
I know with me personally, I have a lot of my patients that I'm actually friends with. I have a close relationship with them, so I've been kind of in touch with them throughout this whole thing. So I called them and, you know, got them scheduled. Some of them wanted to wait. Sometimes we just have a list. We have a list of backlogs that we can go to, but we haven't really had anywhere to put a lot of people because we recently took over some patients from a dentist that retired. So anytime we have an empty spot, they gets filled really quickly. Yeah, but the front desk, they're really great about making us a list of overdue patients, and we call them. And like I said, some want to schedule and some want to wait a little bit longer. So I'm just trying to fit them in.
Are you seeing your full amount that you saw before COVID?
I feel like I'm seeing more.
Are you?
Yeah.
Okay.
I think some people just want to be normal again and just want to get out and get back to normal. Some of them are using this as an
allowed
excuse.
an hour, and yeah, I mean we always allowed an hour for every hygiene patient anyway. So we had a little bit, you know, they're definitely having to push a little bit harder with all the, you know, treatments to the rooms and everything in between. They're definitely having to work a little bit harder to get to stay on schedule, and that means that, you know, we got to show our butts up in the room when we're supposed to.
Yeah.
You've been doing better at it.
Sorry, I'm asking questions, but it's
no, that's what this is about.
Are y'all getting extra time between each patient, or you're just cleaning in between and then going on? Like, we're getting an extra little bubble of time because we're also having to like wait to check in and out because we're not letting people go to the front desk. So, you know, there's just more waiting right now. So are y'all getting extra time, or?
We're making the hour work for us because the dentists aren't seeing as many people at one time. They're able to get to us quicker because that's usually what holds us up. So they've been really good about getting to us on time so we can have plenty of time to check the patient out and get back to our rooms and clean it. And obviously, if somebody else doesn't have a patient, we all help each other out very well at our office. Good teamwork.
I do think that helped, Jennifer, because, you know, and I've actually enjoyed it more. So I'm one of these people that used to always, you know, I always had 2 rooms going, and you know, we've been trying to keep 1 room per practitioner. And even though we have the space, we may use the second operatory. It's 1 patient at a time. We're not jumping back and forth between patients. It's only, you know, each dentist is seeing 1 person at a time. And it really has freed up some time. And crazy enough is we're not really even seeing a change to our production.
Good.
You know, and that's the craziest part, because we're not squeezing all the little stuff around the big stuff anymore.
Yeah, I agree.
So Holly, you can tell them how we're doing that.
Which I'm going to say I'm very thankful for this, but we are currently, originally we had 30 minutes between each patient, but now we've kind of bumped it to a 15-minute window. But like, honestly, I'm appreciative that they've been doing that. It's made our days a little crazy, and we take random lunch times just when we can make it work to get our breaks in. But yeah, we have about 15 minutes because with the fogging machine, we're trying to let it dry. And then, like I said, sometimes we're waiting 5 minutes because there's somebody at checkout that's just won't stop. They haven't left their house in 3 months, so they just won't stop talking. And if we didn't have that extra time, like, I'm very big on time management.
Me too. You can ask Dr. Horowitz. I've always been.
That's like my number one thing that I try to work on, is not getting freaked out about it. But
I know.
It sounds like these two could have a conversation.
Yes.
Yeah, like I'm really appreciative of it, but I'm also, I know, like, so we're not, like, I'm seeing 6 to 7 a day when I'm used to seeing 8, and we have the backlog, so there's that anxiety of, because they're my family.
No, I know.
Yeah, so trying to figure out how we're gonna do this.
So I got a question for you, Holly. How are the patients taking it then when you have to change the schedule? Because a lot of these people were scheduled 6 months ahead. So I'm sure you're having to make a lot of calls, do a lot of rescheduling, and push people out. I mean, that adds some extra burden to your job. And then are any of the patients getting upset with you?
I would honestly say 95% of people are more than willing and accepting right now. We're lucky a lot of people are still working from home, so they're able to juggle things around. But, like, honestly, most people are like, whatever we need to do, we really appreciate that you guys are doing all of these things. Like, I get told that several times a day. So even the waiting to check out, I'm the front op right next to checkout. So people see them up there just talking, and they're like, it's okay, it's fine. Like, we're good.
Yeah.
We have really good patients, like really good patients.
We've had some great things, and I remember when we first opened up, I had an Invisalign check come through, and the gentleman that was in, his wife is fairly immunocompromised, but the flip side of it is that she's not only immunocompromised, but she's a virologist too. So she's been studying the pandemic and the epidemiology of everything, and she's been on NPR and all kinds of crazy radio shows giving her take on it. But I'll never forget what he told me. And this is a gentleman whose wife is so on top of everything. And he was like, he goes, I was very concerned about coming in just with everything that's going on. And he goes, and my wife is immunocompromised, said, if anybody's going to be taking care of this and on top of it, it's going to be Dr. Kirkham and Dr. Duplantis. And that was man, that was awesome. And I know that our patients feel that way. We've had a couple that have gotten upset. But in the end, they got upset just because they could toot their own horn and they could get upset. It wasn't that they were really upset. They just probably hadn't gotten mad at anybody in a few months. But that's like less than 2% of our patients that have gotten upset about this. And the thing is that when they're not upset enough to leave, they're upset enough to reschedule for another day that works better for them. So
that's it. And it seems like they get over it pretty quickly. So, but I'm thinking about something else too now, and that's how some of the narratives have changed. The conversations have really changed in the hygiene room and in the operatories, right? So I know in our practice, one of the things that we had really started focusing a lot on, and Jennifer has been a champion for, is the whole orosystemic connection, and we were really trying to drive the narrative, before COVID, drive the narrative towards the inflammation conversation and towards total body wellness. So I'm going to ask you first, Jennifer, because we've been doing this in our office for a while. I'll ask you first how your narratives have changed and how your conversations have changed. And then, Holly, I'd love to hear your perspective on that too, and on how some of the conversations and your recommendations may have changed.
Well, to tell you the truth, I still kind of approach it the same way. I might start out a conversation with, do you know anybody who got the virus? What were their symptoms? But then I still stick to what we always do. We look at the medical history. That's the most important part. right at the beginning, is see what kind of risk modifiers they have. If they have diabetes, if they have psoriatic arthritis or rheumatoid arthritis, anything like that. And just go straight on into my normal conversation with inflammation and how it can, affect the rest of their body. So, and really this virus, which I'm not too familiar with, but I know it is an inflammatory virus that gets in your blood vessels in your lungs. So, if you have inflammation already, obviously you're not going to do as well with that virus. So we have that conversation sometimes.
That's great conversation. How about you guys, Holly? What's changed as far as the conversations or maybe the recommendations that you're having in your practice?
So I don't know how much of like my systemic conversations, but I've noticed patients seem to be having some more dry mouth or like increased plaque. And there's no sign that I know scientific correlation of this, but I'm feeling like wearing the mask is kind of drying it out and people are getting more plaque buildup. So I'm really trying to stress the home care and the hygiene. If they're needing like saliva substitute recommendation or things like that. Or the patients that are immunocompromised and don't want to come in, I'm just trying to reinforce keeping their home care going until they are comfortable to come in so that they can be as healthy as possible.
That's a great conversation, and it brings up another point because Chad, I think you and I had this conversation, and I go both ways when it comes to masks. Yeah, don't even go there. Yes, I can. Let me say it like this: I can see both sides when it comes to wearing masks. My concern with these universal mask requirements, as opposed to staying socially distanced and outdoors, and is I think everybody is lulled into this false sense of safety with the mask on. And I know that I'm seeing people that like and nothing against these stores, but like in Lowe's and in Walmart, and that they've just been wearing these same Petri dish cloth masks for days and days. Mm-hmm. And so to Holly's point, you kind of wonder what's going on there. Mm-hmm. Can that increase plaque levels? Can that be contributing to dry mouth? Certainly it's going to increase inflammation and I think introducing virons and microbes into the mouth or reintroducing them into the oral cavity and into the upper airway. So I think we have to be careful, and I think that we're going to see some interesting things about some health concerns about people having to have had worn masks.
I totally agree. I feel more tired when I go home at the end of the day.
I do too.
And I really think mm-hmm. that, and I haven't done this, so I can't say I've conducted a self-study, but I would love to see O2 stats after wearing an N95 for a while, and I find myself out of respect for our patients, even when I'm sitting in my office trying to wear a mask more often, and I know that everybody in the office, I mean, really, I'd say that I have the mask on 95% of the day, and before it was at, maybe 40, 50% of the day when I'm in patient care.
And then you're not drinking as much water.
Yeah.
And then you're not drinking the water you need to drink, you're dehydrated.
I'm taking a huge bottle of water to work and trying to drink it throughout the day and drink lots of water. But, I don't want to overextend our welcome here. I know everybody's got a family and I do want to record this and I will push this out to Dinks, but I would love to have a follow-up with this in a couple weeks and maybe invite a couple other hygienists. And I think this just worked out perfectly. Jeff?
I think this was awesome. So Holly, it was really nice to meet you.
You as well.
Nice to meet you, Holly.
You as well.
I think we have a couple of regulars, Chad.
I think so too. I do want to close with this, and I'll start with Jennifer. You all still have a lot of colleagues out there that are reluctant to go back to work, kind of digging their heels in and saying, we're not going to go back. Jeff and I've been reading a ton of articles on poaching, like trying to take hygienists from other dentists. And I feel that I can tell based upon Jennifer's responses, and I hope that Jeff can based upon Holly's responses, that we have a couple of very loyal people here. And I know we're blessed to have both of you all in our individual practices. But what piece of advice would you give another hygienist that was afraid to go back to work? And I'll start with you, Jennifer.
Well, I guess first I would say make sure the dentist is implementing all the safety precautions for you, because if they're not, they might not truly care about their patients or their employees. So maybe there's a reason they don't feel safe going back.
Absolutely.
But if that dentist is following all the guidelines, I don't think there's been any cases much of anything going around in a dental office. I think we've always worked with universal precautions, and now they're even greater, I guess. I feel extremely safe.
Yeah.
I don't know what else they could be afraid of at this point, but
Holly?
I mean, if they're scared, I feel like they need to ask themselves, are they able to go to their dentist and to talk to them as equal? Or, you know what I'm saying? Yeah. Like, hey, I'm not comfortable with this. And if that dentist is not willing to help them or work with them, then they need to, kind of like Jennifer said, like question the dentist's practice as itself. But if you're working in an office with good standards and morals and work ethics, I feel like they're going to do everything they can so that you're comfortable. Because if you're not comfortable, you're going to show that to your patients. And we can't have that either. So
I agree.
Exactly.
Last thing I'd say is if you don't feel safe, there's another job out there for you. Trust me. So
well, it's amazing across the board, across the country. And I've seen a bunch of memes kind of to this effect of, all these people that are afraid to go back to work. And, you've got all, the dental hygienists, the dental assistants, the nurses that have just, they've just charged right back into the office and into patient care. And, they know that if they're handling it the right way, that they're going to be safe. And so, that would be kind of my message for what it's worth to everybody is, just make sure you're using common sense, make sure your employer is using common sense, and make sure that there's that mutual sense of respect.
That's awesome. Well, let's do this again, folks.
We should.
All right.
Thank
you all so much. Jennifer, nice meeting you.
Thank you.
Guys,
Nice to meet you too.
Have a great night.
All right.
Thank you too.
Y'all in South Carolina. All right.
Bye.
Talk soon.
Bye.
Thanks, Holly.